Today, I've got Dr. Justice Archer from University of Bristol giving us just a short summary of one of his works comparing aerosol number and mass of exhalation rates from children and adults during breathing, speaking, and singing. Can you just please introduce yourself and tell us a little bit of your area of research? Welcome.
Thank you. My name is Justice Archer, and I'm a research associate at University of Bristol. And my area of specialization is looking at aerosol droplet microphysics under different conditions. And for the past 15 to 18 months, I've been working on COVID projects looking at aerosol emissions from respiratory activities such as breathing, speaking, and singing in order to come up with mitigations and risk levels for other activities as well.
Can you please let us know just a little bit, why was this research needed?
Yeah, I think that is a good question. I think throughout the whole of the COVID-19, we normally report COVID numbers infection for adults, but we actually don't know the quota of children in transmission or how many children are also involved in the transmission cycle. So the study was to just come up with a quantitative research, which will kind of bring data to estimate what is the risk level when children are also performing similar activities as adults. What are the particles that they're producing in order to kind of assess the risk involved when children are also singing, when the children are also speaking in comparison to adults.
To do this experiment or this study, what design did you use?
So normally when you speak or when you sing or when you breathe, you produce a plume of aerosols. Yes. So this plume of aerosols, they come out as a jet. So it's like a plume, it's a jet. So yes. And because they're coming out into an environment, they kind of dilute quite quickly because they mix us with the air around. So you need a clean space where you could detect zero particles to be able to associate every particle that you measure from someone speaking or someone singing to that specific activity. So we designed this experiment in an operating theater, which is very clean, where you don't have any particles. So the background of aerosols or the background of particles were actually zero. We are using a commercial instrument, which is called APS, aerodynamic particle sizer, to kind of, which measures and counts the number of particles that someone produces when they speak and when they do any other respiratory activities.
So the operating theater usually has one direction flow of air.
That is what you need, because it's the cleanest place, example, anywhere, because in an operating theater, it has 600 liters per minute of air, which is flowing. So which means that over there, everything is clean. You're not able to detect any particle at all. So
yes.
So that was an ideal place to do these measurements.
Yeah. So you had this device that does it measure, does it capture, or does it catch? Does it measure the amount or the concentration or the speed? What does it measure? What do you measure?
This instrument measures the concentration of particles and their sizes. So it actually counts how many particles that you are producing within a volume of air.
So there will be someone there being quiet, and then you capture, you assess the amount of aerosols, and then you tell them to speak or you tell them to sing. What do you do?
So normally we connect a funnel. The person stands in front of a funnel, which is connected to a tube onto the measuring device. So the measuring device is measuring particles at a flow rate of 5 liters per minute. Okay. So when you speak, normally when you speak or when you breathe, you're breathing through an air which is coming out, normally breathing for children or for adults, between 6 to 10 liters per minute. Yes. So out of these particles out of this airflow, 5 liters per minute is being sucked by the instrument, which contains the particles that you are producing. Yeah. So for normal speaking, you have the airflow, which is coming, is around 10 to about 15 liters per minute when you speak. When you sing, is around 18 to about 23, depending on the volume that you are speaking.
So what are the key findings? What would you say are the key findings of your study?
So there are actually two basic findings from these studies, which is quite important when you try to compare aerosol generation from children and adults. And I think what we found was that children and adults, when they are doing the same activity at the same volume, for example, when they are speaking and singing at the same volume, they generate the same concentration levels of aerosols, and the size distributions, that the size of particles that they also produce, are also within the same range, around 0.5 to about 7 micron in diameter. Okay. And these sizes are very important because these sizes can contain the virus. Figure 8 compares the exhalation rate, that's the number exhalation rates of particles produced by children and adults per second. I think there are two things you probably have to focus on, breathing and speaking and singing at the same volume. If you look at the line between, so these are, this box and whisker plot kind of show the range of particles produced by adults and children. Yes. And the white box in it shows the mean values.
Yeah, this is the line. The average, yeah, the mean value, that one. Yeah.
Mean values. Yeah. And the lines are the median values. So and from the mean value, what we found out that there is no significant differences between the amount of particles produced by adults and the concentration of particles also produced by children, which is unexpected because you would expect that adults will produce more particles than children.
You can tell this because the boxes are overlapping, isn't it, really?
Overlapping, yeah. Overlapping. So there is no significant differences between adults and children when they produce, when they are doing the same activity. So if you look at it speaking at 70 to 80 decibel, so normally this is normal speaking. This is normal speaking. This is normal conversational level speaking. You speak around 70 to 80 decibel. And normally if you go to church or something, you're also singing normal singing, unless you are extremely excited, then you will sing at the highest volume, which is between.
But looking at here, singing doesn't look very much different from speaking, actually.
They are the same. Actually, there is no statistical differences between the two when you compare adult and children as well.
So so that's the key message. There's no difference between adults and children when they're performing the same type of activity.
Exactly.
Aerosol producing
activity. This is apart from the number, the mass. The mass is also very important because the mass of the particles, if you show the B, so if you look at the mass of particles generated, I mean, the first one I said, the means and the medians, if you look at it, they are just on point. They are just one on top of the other. It's just the same level of mass of particles produced by adults and children. Yeah, so you don't have any differences when it comes to particle generation by children and adults, and which means that mitigations, probably we missed the point, mitigations for adults should also aim at children when they are performing the same activity.
Yeah, thank you so much. Is there any other thing and any other finding you wanted us to discuss?
I think once you speak of mass, then you also want to look at the sizes of particles generated, which is also quite interesting because then you begin to see that the size range of particles produced by adults and children are almost the same, except breathing, because the lung volume of children is quite smaller than adults. So when it comes to the size of particles produced by children, they are quite small. And it's not that they are quite small, it's just that their concentration is quite low. So this graph is also quite interesting because it demonstrates a lot of things which are happening here. One, it shows where particles are being produced from in your vocal tract. Yeah. It also shows the range and the sizes of particles being produced. So if you look at these particles, let's say if you look at speaking 70 to 80
before I get to this speaking, just tell us a little bit about breathing here. You can see here children really breathing is a bit lower than.
Yeah. So I think this breathing has very low concentrations when it comes to the size of particles by children. And I think what we believe is just due to differences in lung volume of children compared to adults.
Because children have got smaller lungs compared to adults.
Smaller lung volume compared to adults. So this is what we believe is the reason. But normally, during speaking and singing, they generate the same range of particles, which shows a bimodal distribution. And this bimodal distribution is quite important.
That's good. A little bit of hump there and goes down.
Exactly. So you have the first hump and the second hump.
Yes.
So the first hump shows you the size of particles which are being produced, for example, in the bronchioles.
Okay.
In the bronchioles, so it shows you the range of particles which are being produced in the bronchioles. Then when you go to the second hump, which is the second mode, it also shows you these particles are coming from the larynx, because the larynx is.
So this is the second mode, this one, absolutely.
The second mode is around 1.1 micron to within 2 micron, within that range. So those particles are coming from the larynx, and the larynx is where all your vocal activities come from.
Yes, thank you so much. This is really interesting stuff.
Yeah.
But I just think if you can give us just a kind of take-home message, what all this means in practice, or just a conclusion, really, something like that.
Yeah. I think the general conclusion of the study is that adults and children produce the same number of particles and masses of particles when they are doing the same activities such as vocalization. The take home is that, which means that mitigations which were aimed at adults should be applied to children when it comes to, for example, doing activities in closed spaces, for example. So in all these studies, what is also very important that I did not mention is ventilation, right? So in a closed environment where ventilation is poor, which means there's mitigation, which kind of forces adults to wear masks, also be applied to children. So this study is for children from 12 to 14 years.
Yeah, thank you very much. This is really interesting. I'm sure you will give us another summary some other day.
Yeah.
If you're happy for me to share your Twitter handle, I'll put it at the bottom so that you can continue.
Yeah, that's fine.
It'll be really interesting to see your future work, Justice.
Yeah.